So for the large majority of people who have back pain, imaging in the form of X-rays or CT scans or MRIs really don't show us the cause of the pain, and so they're not necessary. And then for some people who have them, it can show up an incidental finding or a finding that's not relevant to their condition, but can actually cause a lot of grief. So it could lead to other tests and other treatments that are also unnecessary.
A lot of people who have got pain and low back pain will often ask for maybe various MRIs or scans, and nothing may show up. And they're concerned, it must be something really bad if they can't find anything. And it's not to say that they're not experiencing pain. Pain is determined by the brain, which decides whether you're in a dangerous situation.
Imaging is taking a picture, whether it's an X-ray or a CT scan or an MRI, and that picture doesn't tell us which of those tissues are actually causing the pain. It gives us a picture of your tissues, but it doesn't tell us which is the cause of your low back pain.
I have found that scans will show symptoms or show some really interesting history in my body, but in terms of understanding the underlying causes of those symptoms, I think scans can fall short.
But if you're having your first episode of low back pain, or even your second or your third episode of low back pain, imaging, whether it's a plain X-ray, CT scans or MRI, usually tell us very little about your condition. And in fact, there's even some research saying that if you have too many or have X-rays, such as an MRI, for example, that it can cause you more worry than it actually helps you not to worry. Because there are a lot of things that will show on X-ray that are normal anatomical variations, that are normal age changes that really have very, very little to do with your back pain.
Unfortunately, imaging for people with low back pain has been overused in the past. We have to be aware that it's not completely harmless. X-rays in particular and CT scans do cause radiation, albeit very small, but they do cause radiation. So it's best to avoid doing those imaging tests unless it's absolutely necessary. And for the large majority of people who have back pain, those tests are not necessary.
Also, I wouldn't particularly like too much X-rays in my pelvic region. The dangers associated, particularly with plain X-rays and CTs, is that you're radiating your pelvic area, which again is not a wise thing to have unnecessarily. An X-ray is necessary if there's a clinical indication to have an X-ray. So a couple of examples of that is if the clinician is thinking that there's something seriously wrong with their back, what we call a red flag. In other words, the nasties like a tumour or a fracture, etc. And remember, that's quite rare. The other indication would be, for example, if a person is having a workup pre-surgically. So in other words, they may have the low back pain and raging sciatica, and there is a suggestion that they may need surgery. That's when they'll need imaging.
Quite often I get asked by patients if they should have some imaging, specifically X-rays or maybe an MRI. No is a general rule, unless there's a red flag or something quite serious that's jumping out at us and making us concerned. Often signs on an MRI, but that some of these people don't actually have any pain. So there is not a direct correlation always between what you find on MRI, for example, and someone's pain. And the concern is that if somebody has pain, has an MRI, has disc degeneration, etc., quite often their interpretation is, oh, that's it. I've got my pain forever. I'm never going to get better. The fear sets in. Fear avoidance behaviour can start. So people become scared to move, and so it actually has been shown that to have these scans too early or unnecessarily can actually be detrimental to the recovery because of the fear that it does place on people, and it can often be unfounded fear.